Good day, sir. I am Chris Madel Tayopon, your nursing aide for today. And today I will going to perform removing a nasogastric tube. So, equipments materials needed are disposable pad or towel, tissues, clean gloves, 50 ml syringe, this was optional, plastic trash bag, then we're going to proceed for assessment. So, we need to assess first for the presence of bowel sounds. Afterwards, we're going to assess for the absence of nausea or vomiting when tube is clamped. Sir, do you feel anything?
No.
Okay. Then, afterwards, for planning, check the client's status, then identify the equipments materials needed. So after gathering materials, I bring it to the bedside so that it will save time and effort. So afterwards, for implementation, introduce self and verify client's identity using emergency protocol. So good day, sir. I am Nurse Madel, your nurse for the day. May I know your name,
I'm Jonas.
birthday?
October 16, 2004.
Okay. So, the client is conscious, so he can answer. But if the client is unconscious, we can check the hospital bracelet. Ask the significant others or family if they are present. Then, we are going to check the chart of the client to verify his identity. Then, next, explain to the client what we are going to do, why it is necessary, and how she or he can cooperate. So, sir, today we're going to remove that tube attached to you because you are fine now and you can eat something good. I hope you want to cooperate during the procedure so that we are doing the procedure good without mistakes. So afterwards, assist the client to sitting position if health permits. But if not, stay in high fowler's position. Then perform hand hygiene and observe other appropriate infection control procedures, and afterwards provide privacy to the client by closing the curtain around the bed and close the door if possible or applicable. Then place the disposable pad or towel in across the patient's chest. um, this will help the client for any uh, secretion from the tubing, so that he doesn't contaminate. Then afterwards, provide tissues to the clients. This will help the client, or he can wipe his mouth or and nose later when the suction uh, was removed. Sir, can you hold this one? Later you will wipe your nose and mouth. Mamaya. Then afterwards, we are going to detach the tubing. So, disconnect first the nasogastric tube from the suction apparatus. and then afterwards, unpin the tube from the client. So it was afterwards, remove the adhesive tube from the nose of the client. Excuse me, sir, just remove this one. Then after removing the tape into the nose, we're going to remove the gastric tube. But before that, we're going to put on gloves to protect us from the secretions. Installing 50 ml of the air into the tube was optional because this clears the tube of any contents such as feeding or gastric drainage. Then after that, ask the client to take a deep breath before removing the tube. Then, because this closes the glottis, to prevent accidental aspiration of any contents from the tube inside. Then pinching the tube prevents any content. So we need to pinch the tube before removing it. Then to prevent the drain from the tube, then inside. Then smoothly withdraw the tube. Sir, can you please take a deep breath and hold it. Slowly remove. It's alright. Sir, can you please wipe your nose and mouth for the secretions? Then the tubing will place in the trash bag after removing it to the client's nose. Then afterwards, observe the intactness of the tubing. And then by using Sir, can you please open your mouth? Okay, close. And after that, ensure the client's comfort. So if there is something scrapes, you need to clean it, then assist the client as required to blow the nose. Sir, can you please blow your nose? Okay. Do you feel better?
Yeah.
Any obstruction if you are breathing? Okay. Afterwards, if the clients finally successfully blow his nose, so it will help excess secretions that accumulate in the nasal passage will come out. Then dispose the equipments appropriately. Next, we need to wash hands. or perform hand hygiene. After washing hands, for evaluation, we need to perform a follow-up examination such as presence of bowel sounds, absence of nausea and vomiting, when tube is removed, then intactness of tissue of the nares, relate findings to previous assessment, data if available, then report significant deviation from the normal to the primary healthcare provider. Then for documentation, document all the relevant information. So we need to record the removal of the tube, the amount and appearance of any drainage, if connected to suction, then any relevant assessment of the client. So today, patient Jonas was successfully removed his tube, the nasogastric tube, and the appearance of the drainage is good. Then the client was feel discomfort when removing by saying that he feels itching, but afterwards, after removing, he feels relieved. Then the client was totally fine for now after the procedure done. That's all. Thank you.